Hello, and welcome to everyone to this webinar entitled Disability Data in International Cooperation. Thank you for joining us. This webinar is being organised by CBM Switzerland with the support of the parliamentary group Suisse, Solidarité Internationale. My name is Mary Keogh. I'm the Director of Advocacy at CBM Global, and I will be moderating today's webinar. I would like to start, first of all, with some housekeeping rules. This session is being recorded and will be posted online after the event. International Sign Language interpretation is being provided. If you require multi-pinning, please let the host know through the chat box so that they can activate that for you. Live captions are also available for this event. Click the CC Closed Captions button at the bottom of your screen, or click on the external link provided in the chat box. In the menu, you will find a chat box and a questions and answers box. Please only use the chat box for technical questions related to this webinar, and then you may enter your content-related questions for the panelists at any time in the questions and answers box. I will be presenting the speakers as we go along. Please consult the program provided in the chat box for an overview of the speakers and topics covered in today's webinar. Today's distinguished panelists will speak to the question, how can we strengthen the collection and analysis of data on disability? And why is it so important? They will share their experiences and their practical tools in disability-related collection. In that regard, I would like to hand over directly now to Mr. Christian Lohr, member of the National Council of the Swiss Parliament, which is currently in session. Mr. Lohr, thank you very much for taking your time to join with us today. We now give you the floor for some opening remarks.
Good morning to everybody. It's a great pleasure to speak to you, and I will take the place now to make some introductory remarks. Thank you for participating in this very important webinar hosted by CBM Switzerland, with support of the parliamentary group Swiss Solidarité Internationale on the topic of disability data in international cooperation. How can we strengthen the collection and the analysis of data on this disability? This is the main question today. According to World Report on Disability, 50% of the world population has a disability. That's about 1 billion persons. Of this, about 80% live in low and middle income countries. Persons with disability often lack access to essential services, are more likely to be poor and more likely to be discriminated against. The availability of data on this group is still scarce, but has improved greatly and in recent years. Systematic data collection is essential to ensure we know the prevalence of number of persons living with a disability, which then allows us to identify the needs and measure the gaps. Only the collecting data on whether or not persons with disabilities are being included in the international development and social progress can we ensure their full and equal participation on an equal basis with others. Disaggregated data can provide a better comparative picture of what kind of intervention work and what doesn't work. It can also help inform and promote evidence-based policy. Disaggregating their data by disability is also essential to monitor progress in meeting the goal of leaving no one behind established under the 2030 Agenda of Sustainable Development. Switzerland ratified the CRPD in 2014 and thereby committed itself to implementing entirely both nationally and its international cooperation. Switzerland is also committed to implementing the Agenda 2030 and its Sustainable Development Goals, which are closely tied to Switzerland's own international cooperation strategy 221 to 224. Switzerland is also dedicated by the data agenda more broadly. The Swiss Confederation is hosting the upcoming World Data Forum in Bern from 3rd to 6th October, bringing together the two communities of data producers and data users. One central theme of the forum is leaving no one behind. However, Switzerland is not yet a pioneer in collecting data on disability in its international cooperation. If we are really committed to ensuring that no one is left behind in international development cooperation, we must ensure that everyone is counted. Thank you very much to all panelists who are joining us today. We look forward to hearing and learning from you.
Thank you, Christian Lohr, for your warm welcome and for highlighting the importance of disability data collection, as well as Switzerland's commitment. We will hear from you again at the end of the webinar for some closing remarks and reflections. Our next presenter is Professor Hannah Cooper, who's Professor of Epidemiology and Director of the International Centre for Evidence and Disability at the London School of Hygiene and Tropical Medicine. Hannah will provide an overview of some practical tools and experiences in data collection and analysis, including international cooperation. But before handing over to Hannah, however, we would like to begin with a short video of a young woman with a disability in Bangladesh. Hannah will then begin her presentation directly after the video.
My name is Kajol Rekha and I'm 23 years old. In 2003, I had an accident. I fell off a chair and one of my vertebrae slipped and severed my spinal cord. Now I am paralyzed. Before the accident, my life was good. I was living with my parents and going to school. And then they both suddenly died. My brothers looked after me and arranged my marriage. However, after my accident, my husband left me and remarried. It was difficult and painful. I suffered a lot. Previously, I was treated with affection by everyone in my family. But that all changed. I was neglected and I became a burden to everyone. Life became much better for me once I was given my wheelchair. I used to be totally dependent on others, but now I can get out and move around. I received income generation training from a local development agency in growing vegetables and rearing chickens and ducks, then purchased a hand sewing machine and now draw an income by tailoring garments for people in my village. My house was modified to meet my basic needs, such as sanitation, making safe drinking water, and my lavatory accessible. It was also raised to reduce the impact of the floods. When it comes to floods and other disasters, people with disabilities are particularly vulnerable. There is generally widespread panic, and in many cases, a person with a disability is forgotten and left behind. So now I am part of a disaster preparedness committee. And we've made a list of all people with a disability in our area, and we can take immediate steps to locate and evacuate them. I am also responsible for educating people about hygiene and general health for when the waters hit, such as how to protect their food against insects and contamination. Previously, I was afraid of the prospect of flooding, but now that we are prepared, I know what to do and I can face it. Now I am no longer a burden to my family, and I am proud that I am a valuable and contributing member of my community.
So good morning, everybody. My name is Hannah Cooper, as I was introduced, and I'm the Professor of Epidemiology at the London School of Hygiene, and I'm also the director, one of the two directors of the Disability Centre there. Thank you for those introductions, and today I'm going to talk a little bit more about disability inclusive data collection, why it's so important. So as we heard in the introduction, 15% of the world's population has a disability. So there are many Kizils, as we just saw in the video, making up this 15% or 1 billion people. And as we also saw in the video, and as we've heard already, people with disabilities are often left behind in many different spheres of life. So in the video, we talked about discrimination, violence, abandonment, isolation, but there's also often exclusion in terms of education, employment, and health. But what we also saw is that this isn't necessary, and that with appropriate supports and programs and adaptations, people with disabilities can be included on an equal basis with others. But what that means is there needs to be disability inclusive interventions to support the participation of people with disabilities. And to start these kinds of interventions, and we saw of a few in the program about things like livelihood support or adaptations to houses, we need data. We need data to plan. We need to know what the important issues are that need to be tackled. We need data to implement. We need to know what we should do and how. And we need data to evaluate, to see whether what was implemented worked and was appropriate to the needs and desires of people with disabilities. So as an example, in the video, we saw that the woman faced lots of issues around poverty. And so one of the common ways of trying to tackle poverty is through implementing social protection programs to alleviate poverty among people with disabilities. So we may ask ourselves, is this something that the Swiss government or others should support? Social protection? Well, the first question would be the planning. Is there a need for this? Is there a need for social protection? Well, we've got this evidence for planning on whether data of disability and poverty are linked from surveys. And we did a review of 150 surveys from low middle income countries and showed that 81% showed a positive association between disability and poverty. So the data shows us that yes, poverty and disability are linked, and so it's appropriate to try and tackle that through interventions. The second question that we may ask us then is, do disabled people already receive social protection, or is this something that we should try to scale up further? And here data can help again. So we helped with a national survey of disability in the Maldives, and we found that only 26% of people who were eligible for a disability allowance were receiving it. So that many people who needed this allowance and who were eligible for it weren't getting it yet. A third question is then, does it work? Should we try to scale up this disability allowance? And again, data from the Maldives helped us to look at that question. And once people with disabilities were given this disability allowance, it was shown to improve health, but it showed that there wasn't an improvement in poverty. And that's because the amount given was too small. And so that was also really valuable data for trying to improve this intervention by saying in its current format, it wasn't working. But if the amount given was greater, then it had the good possibility of trying to reduce poverty. So when we're starting to think about investments and how to try to support people with disabilities, data can really, really help us work out what's needed and how to do it. So data helps with planning services, with the best implementation of services, and the evaluation helps us to see what we can do better in the future. So how can we get more data on disability to try and answer these kinds of development questions? Well, there's been a really big improvement in the data available on disability in the last decade or so, and that's because there's more consistency in how we should measure disability. And what the UN agencies recommend is that we use the Washington Group questions. So what that means is that there are 6 questions. People are asked, do you have difficulty with seeing, with hearing, with walking, with remembering or concentrating, and with self-care and communication? And people can answer those questions and say they have no difficulty, they have some difficulty, they have a lot of difficulty, or they cannot do that activity at all. What happens is disability, the presence of disability is indicated if somebody says they have a lot of difficulty or cannot do in at least one of those activities. So it is not a perfect way of measuring disability, but it is simple. It's just 6 questions and it's used consistently around the world. And what this means is we can now start to generate a lot more data on disability to help us to think about programs. So for instance, in a program, in a big survey of people with disabilities in Nepal, people with and without disabilities were compared. And in turn, they were found to have poorer self-rated health. So 75% of people with disabilities, but only 13% of people without disabilities said they had poor self-rated health. Of children, only 57% of children with disabilities were enrolled in school, while all the children without were. Only 24% of people with disabilities were currently working in the last year, compared to 75% of people without disabilities, and 49% of people with disabilities face food insecurity, compared to 26% of people without. So using this kind of data shows us where the needs are, which is really important for planning. And the disaggregation of data by people with and without disabilities was identified through the Washington Group questions. But as well as disability-specific surveys, you can also start to put these disability questions in general surveys. So for instance, the demographic health surveys are done all around the world, including recently in Nigeria. And so you can uncover things like whether the need for contraception or knowing about family planning was shown to be a lot lower here among women with disabilities than women without. And the FCDO funded programs in Nigeria is now using that to try to plan services. So what are the kind of options that we have for disability data collection? And I've described them a little bit already. So the first thing we can do is disability specific surveys. So large scale surveys like that were done in Nepal to try and really understand what the experiences are of people with disabilities compared to those without, and to see how we should target services. But they can be expensive, so they could maybe only be done every 5 to 10 years. Another option is to include disability measures in mainstream surveys. And because the Washington Group questions are short, they've been used widely, as I've said, in things like the demographic and health surveys, in the mixed surveys of UNICEF, and in many censuses around the world. And that allows data disaggregation, so comparing all sorts of indicators between people with and without disabilities to see if people with disabilities are being left behind. And so one of the things that we should all focus on is further inclusion of disability in these mainstream surveys, but also the analysis of data that is collected, because sometimes disability is included, but the disaggregated analyses aren't done. And a third way that we can think about is using routine data resources. So for instance, in the UK, people with learning disabilities can register on a learning disability register and receive additional health services. So in the UK, we've been able to track through that register and show that people with learning disabilities are unfortunately more likely to die from COVID. And so they were prioritized for vaccination, but other disabilities aren't yet registered. So there is less data there. So we can also start thinking in programs for monitoring and evaluation, how to include disability to see whether the kinds of programs and interventions that are funded are also inclusive of people with disabilities. And when we think about where to invest and what kinds of things to do, we need to weigh up the pros and cons and things like costs. So we may get more data from disability specific surveys, but it's more expensive. Ease and what kind of opportunities there are, but also the relevance of the data, so that we're collecting data that helps us in planning, implementation, and evaluation. And across all of this, we need to think about quality of the data. We need to make sure that the data collection is used to inform programming, that we always work in collaboration with people with disabilities to make sure that the data collection and its use is appropriate, and that this is adequately resourced. So thank you very much for your time and attention, and I'm very excited to hear what the other speakers have to say on this topic. Thank you.
Thank you, Hannah, for this very informative presentation. And I see there's a question in the chat box, so we will come back to that at the end, Hannah, if that's okay. And now that we have the overview of the basics of data collection, I would like to invite the next set of panelists to join me for a moderated discussion. Please remember that you can post your questions into the questions and answers box at any time during the webinar. And please keep the chat box for the technical issues. We will have some time for questions after the moderated discussion. So if I can ask the panelists to turn on their videos, please. So I can just do a quick introduction. Christian, Polly, and Lisa. I'll just check if, Lisa, are you okay with your camera?
Chantel has to turn it on for me.
Okay, Chantel, thank you. So with us today, we have joining us from Fiji, Ms. Lisa Veretti, Director of Operations at the Pacific Disability Forum, a partnership of Pacific organizations of and for persons with disabilities. So good evening, Lisa. Lovely to have you with us.
Good evening, Mary.
We also have with us my colleague, Mr. Christian Medino-Hawk, Humanitarian Director at CBM Global. Good morning, Christian. Nice to have you with us. And our third panelist is Ms. Polly Meeks, independent consultant and researcher specialized in development finance and inclusive development. Polly, great to see you again. So panelists, if we can turn off our cameras, and myself and Lisa will keep ours on just for the moment. And Lisa, we'd like to start with you first. So the first question is, you are Director of Operations at the Pacific Disability Forum, a constituency of organizations of persons with disabilities in the region. Could you tell us a little about your experience in influencing disability data collection and disaggregation efforts with national governments in the Pacific region? And we have approximately 5 minutes, Lisa, for your response. Thank you so much.
Thank you for that, Mary. Very good evening. Very good evening from the Pacific, and it's certainly good to be connecting and the opportunity to share the work that we have done in the Pacific region in terms of our advocacy around disability data disaggregation. So PDF, in short, we have membership around the 20 Pacific Island countries and territories, and since the SDG in 2015. And then on the use of the Washington Group short set, and thank you, Hannah, for sharing those PowerPoint earlier. And so one of the things that we had to do as an OPD in the Pacific to look after our membership was first for us to school ourselves with what is the WGSS 6 that is used in censuses. So we had to, one is to advocate for the use of the questions. Two was to target the countries that was holding censuses, whether it's a 4-year census or 10-year census, and then also to work with the regional organizations whose work is focused on disability data, and that we worked closely with UNICEF in the Pacific, as well as the regional, the Pacific Regional Organization specifically mandated for data and statistics, and that is a secretariat of the Pacific Community. So we work we forged partnership with these two organizations so we could, push and also advocate for disability data and the use of the Washington short set in censuses. And so we started this work probably 6 years ago. I started in 2015. And so in every, since 2015 up until to date, 2020, every Pacific Island countries that has held census for the last 5-6 years have used the WGSS, the short 6 questions. So what we had to do as a regional OPD, we had to support our national members, the national OPD, so they know what is the tool. So we had to school ourselves, build our capacity to understand the tool before we take it to our national government, that is the National Statistics Office, whom we were wanting to engage with so they could take on the question in the census. So build capacity on the tool, organize the OPD to understand the questions, what it can do and what it cannot do, understand what data it is going to produce and how we could use the data afterwards. So it was critical for us to form partnership with our national government, and also because we are a regional OPD, it was also important that we work in partnership with regional organization whose work is to collect data, and that is with UNICEF and also with our own regional organization responsible for data collection and statistics, and they in turn support the National Statistics Office. So all around with the advocacy efforts, not only from us as OPDs, but from other partners, with the UN agencies, with INGOs that we work with, and also with other regional organizations, we were able to, every countries, I think I've listed 10 in the last 5 years that have held census, we were able to for the countries to use, for them to use this the short 6, and apart from just the census data that comes out, one of the critical area that we looked into is just having the census report was not enough for us. We wanted to know exactly how is it disaggregated for persons with disabilities around sectoral areas or thematics. We wanted to know how many children with disabilities are in school compared to children without disabilities. We wanted to know, how many has employment opportunities, who are at work, who are not at work, for persons with disabilities compared to those without a disability. So across the wide, a few sectors or thematics, we wanted to know the disaggregation, how persons with disabilities, if they are in school or not in school, found work or not be able to find work, have access to clean water, have access to services. So it did not stop at just advocating for the use of those 6 questions in censuses through the partnership that I had mentioned with UNICEF and the regional organization responsible for data. After the census, and of course the National Statistics Office had to produce all kinds of report, we had to work with them because we wanted a disability monograph out of the census data. So in those countries that I have listed, which is on the PowerPoint, to date, I think we have about 6 monographs. Each country has a 6 monograph, a specific report just on disability, disaggregated across sectoral. So you could pick up a disability monograph, let's say for Palau or for Samoa, and you could see in terms of education, health, WASH, employment. So these are some of the things that we have worked together with our members and also with the support of partners to be able to bring forth disaggregated data for persons with disabilities across the countries.
Could I just come in? Thank you so much. I don't mean to cut across you there. It's just in terms of timing, and it's really interesting and quite an exciting and interesting journey that you've been on with PDF. And thank you for sharing that. But maybe just to come to you, because I just have a second question to ask you, if that's okay.
Sure, Mary. Yeah.
And
yeah.
I think you've started to speak about it there. So now that you have more data available through the census and additional disability surveys, can you share an example of how this data has been used to support interventions to address the barriers faced by persons with disabilities? And again, Liza, just to say 5 minutes, I'll come in if I see you go over that. Sorry to do that, but it's just we have so many people to get through and to hear from as well. But over to you, Liza, for that question. Thank you.
Definitely, Mary, definitely. So for the countries that I had mentioned that has done censuses, most of them have ratified the CRPD, and hence, you know, the state obligation, and that's why we pushed hard on the segregated data. So now that we've had in those countries the disability monograph, one of the areas that have really, you know, helped us to push some of the advocacy in terms of services, or even in terms of support, and one of those is social protection. There are a few more countries who are developing their social protection, a scheme for persons with disabilities, in particular the disability allowance. And so these countries that I've listed, they've used the disability monograph data collected through census, you know, as in terms of to add on to the identification of persons with disabilities. So it was easier to go back to the disability monograph and using those census data through the monograph to identify, you know, in terms of the degree. Hannah talked about the responses, and those responses would indicate the degree of difficulty or the severity of difficulty in performing those activities, whether it's seeing, hearing, walking, remembering and concentrating, or communication, including self-care. So because it was new for us to advocate, and because we wanted support, because the data shows that not many persons with disability found employment or are at work. So in terms of income support, or in terms of meeting the extra cost of disability, was also always burdensome for the family. So the advocacy for a disability allowance, we went back to use the disability monograph data collected through census and through the monograph. So that has been helpful, because then we asked, so, you know, so what are the data? I said, yeah, we have here the disability monograph. You can start here while you develop systems and processes and your identification. This is the first place that you could start in terms of how do we allocate resources and how would we resource disability allowance. So it's new for us in the Pacific, and there are many more countries who are developing, a few more who are developing the disability allowance as part of their social protection scheme. And these countries have used this data, you know, as a first point of reference to how do we identify, how do we understand the severity of difficulty of performing those activities with persons with disabilities. And this end of the you know, this side of the world for us, we face you know, category 4 to 5 cyclone almost every year, if it's not us and it's another part of the Pacific. So even during preparedness and response and recovery, this data that is collected through census and now with a monograph is quite helpful, and I could add in terms of education, you know, in terms of employment, in terms of accessing health services, in terms of WASH, in terms and there are many more to add to that. Maybe Mary, I can stop here with that brief, and if there are questions or comments I could take later on.
Great.
After
yes,
the session.
Absolutely, Liza. Thank you very much. We'll come back with questions and answers, and thank you so much for sharing the experience from the Pacific region and why advocacy and data disability collection is so important and the impact it can have. We'd now like to move to Christian Medino-Hock. Christian, if you'd like to turn on your camera. And Christian will give us a humanitarian perspective on the importance of disability inclusive data in humanitarian emergencies. So Christian, lovely to see you. Christian, the question first and foremost to you is, why is data important to ensure disability inclusive humanitarian programming? Could you give us some examples from your work? Thank you.
Great, thank you very much, Mary, for your question, and hello everyone. So Yeah, to answer, disability inclusive data in the humanitarian sector is still pretty much an emergent area. So often data collection and disaggregation methods are insufficient, which leave significant gaps in the evidence on inclusion across most humanitarian contexts. So although there has been some progress and efforts over the past years to raise awareness and develop new tools, new guidance, and also good practices from some organizations, generally speaking, the humanitarian sector is yet far from delivering consistent disability inclusive programming. So what is really the problem or the challenge? So one is that humanitarian actors do not know how many persons with disabilities are affected in a given crisis. And the second challenge is that humanitarian actors also lack information and knowledge about available or appropriate tools to collect disability data in humanitarian settings. Often they use binary yes/no questions, such as do you have a disability or a medical condition, which leads to underreporting. So this is one of the main reasons why persons with disabilities face exclusion and discrimination during humanitarian crises. So why is data important then? So first of all, it's to identify populations with disabilities. So we need to get a sense of prevalence. And just to give an example, in the Syria humanitarian crisis, OCHA identified approximately 12 million people in need of humanitarian assistance, out of which 3 million were persons with disabilities. So this gives a sense of the scale and helps also plan accordingly. The second reason why data is important is to analyze the risks persons with disabilities face and the factors that contribute to those risks. This includes also the effects of crisis in mortality, in the nutrition needs, food security, health, and other essential needs. Thirdly, data is really important to identify barriers, be it physical, attitudinal, or institutional, to accessing humanitarian services, but also the enablers. It's important to see also what allows persons with disabilities to access those services, without which there is no way of providing inclusive services. Maybe lastly, data is really important in humanitarian context to hear and to understand the roles and capacities of organizations of persons with disabilities, as well as their views and priorities. I think, without this, humanitarian organizations cannot be really accountable to affected populations, nor develop fruitful partnerships with organizations of persons with disabilities. There are, the modalities that organizations use to collect data in humanitarian settings depend on mainly two big factors. First, the context you are operating in. So, for example, in sudden onset crisis, an earthquake, for example, it is very hard to collect detailed individual data early in the response. So efforts should be made in those contexts before the crisis hits, so during the preparedness phase. So there are contexts in which we know that crises may happen regularly. There are high-risk contexts, and so that data needs to be gathered beforehand, so that when response happens, you have already preliminary data that helps inform your programming. Other contexts, such as displacement of refugee emergencies, data is usually collected at the individual level during the registration of refugees. So it's difficult to get that data beforehand. And in other contexts, such as protracted crisis, be it cyclical or frequent droughts, let's say in the Sahel region, data can be collected frequently and used to help monitor the performance of humanitarian programming. So that is a modality considering the context you're operating in. But also it is important to consider the sectors of intervention and the objective for collecting the data. So for example, if you're an organization focusing on delivering WASH services, it might be important for you to understand if some persons with disabilities may be more at risk of dehydration, showing that you need to provide more water or more clean water, for example. You may find that some other people have issues of incontinence, who need extra water, materials for incontinence, or safe waste disposal. Similarly, if you're an organization focusing on shelter, you might need to, and working, for example, in evacuation centers, you might need to collect data on the accessibility and the safety of the premises and evacuation centers. So all these factors determine the type of data collection tools and methods that will be used. And maybe lastly, it is important to disaggregate the data by sex, age, and disability in order to understand the different ways in which persons with disabilities experience a crisis, and so that you can monitor their access to assistance.
Thank you. Yeah, thank you, Christian. So just coming on to the next question for you, and again, sorry for cutting you off there just in terms of time. What are some of the existing data tools that the sector can utilize for humanitarian programming? And how have these tools been used so far? So it would be great to hear a little bit about those tools. Thank you.
Yeah, thank you, Mary. There are not a huge amount of tools, but the most widely tested tools used to generate comparable data about persons with disabilities are the Washington Group set of questions. They are increasingly being used in humanitarian contexts. They are very useful to get a sense of prevalence and disaggregation. However, they are not useful for identification of specific health conditions or diagnostic categories. So, and the Washington Group set of questions do not address mental health or identify barriers persons with disabilities face. So this is a set of tools which is more and more being used in the sector. There is also the extended set of the Washington Group, which contains additional questions that capture information around anxiety, depression, pain, fatigue, use of assistive devices, and other environmental factors. Another tool is the UNICEF Washington Group Child Functioning Module. This is slightly longer than the Washington Group, but it gathers data on children and youth in the range of 2 to 17 years old. And normally, when you use these tools, the respondent tends to be the primary caregiver and not the children in question. Humanity and Inclusion has developed a couple of years ago a very good learning toolkit around collection of data and the application of the Washington Group questions. So this is a tool that we can definitely share, and it's a self-training toolkit, which is really good. The International Rescue Committee has also recently developed a very good toolbox. It's called the Inclusive Client Responsiveness Guidelines. And among other things, it provides very good guidance on how to conduct focus group discussions or key informant interviews, which are inclusive of persons with disabilities. And this is particularly important when collecting qualitative data, as the Washington Group questions offer you a lot more ability to get quantitative data, but qualitative data needs to be gathered through other tools. It is recommended for humanitarian actors to use secondary data as well, be it government statistics, refugee registrations, or surveys. However, when using secondary data, it is important also to consider and take that with caution. No? How is the concept of disability understood, for example, or is a stigma a factor? What counts as a disability, or for what purpose is disability collected? So they have to be used with caution, but they remain a useful resource. When it comes to identify barriers of persons with disabilities, accessibility audits are a good tool. They help evaluate the level of accessibility and safety of facilities and service delivery, for example. Post-distribution monitoring systems. There are questions that can be added to the post-distribution also to assess how adjusted and adapted the services are to the needs of persons with disabilities. And I think feedback and complaints mechanisms are also a very good tool to gather more information. Where we get a lot of demand by the sector is how to make the feedbacks and complaints mechanisms accessible, which is an area of research at the moment. So I hope that was useful.
Yes. Thank you very much, Christian, for giving us insight into the humanitarian side of disability data collection and analysis. I realize there's questions coming in, so don't worry, we will get to them after our next panelist, who is our final panelist. I'd like to turn now over to Polly Meeks, who's recently conducted a series of fact sheets on disability inclusion in international cooperation of several European countries, including most recently for Switzerland. Polly, you've recently undertaken this research on the status of aid spending on persons with disabilities in various European development agencies, including most recently, as I said, the Swiss Development Corporation. What have you found, and what are some of the main gaps in terms of data? Over to you, Polly.
Thanks, Mary. So yes, I looked at 11 major development agencies altogether. And in looking at their use of data, I was looking from two different angles. So first, I was looking at whether they were collecting data on the objectives of their projects, whether these projects intended at the outset to be inclusive of persons with disabilities. And then secondly, I was looking at whether these agencies were gathering data on the results of their projects, whether those projects were actually accessible to and inclusive of persons with disabilities in reality. So to look at the first of these angles on the objectives of projects, the main tool that I was looking at there is a relatively new tool introduced by the Organization for Economic Cooperation and Development called the Disability DAC marker, which allows agencies to record data on whether their projects aim to be disability inclusive, and then that data can be aggregated on a centralized database. Now, positively, I found that Switzerland is making use of the tool, and that's already a good start because not every agency that I looked at was making use of it. But then less positively, I'm going to try to share my screen here. Switzerland was only using the tool for a minority of its projects. So in 2019, only 13% of Swiss official development assistance projects were assessed using this disability marker tool. So in other words, for the remaining 87% of projects, we just don't have any data on whether they aim to be disability inclusive or not. Then for the second angle that I was looking at, that's data on the results of projects. As other panelists have mentioned, key tools here include both quantitative and qualitative data collection methods. And positively, I found that the Swiss Agency on Development and Cooperation has guidance that encourages teams to, in fact, requires teams to gather disaggregated data, disaggregated by at least one risk factor in being left behind. So a range of factors that could be indigenous status, ethnic minorities, LGBT or disability. There'll be some disaggregated data, and there's also an encouragement to gather qualitative data. But what's missing is a systematic requirement that among those different risk factors on being left behind, data on persons with disabilities has to be gathered systematically and consistently across all projects. So I guess to sum up, what I found was that there's a real opportunity here for Switzerland because it's already been making a good start, but it could easily build on the start that it's made and become much more systematic in the way that it gathers data on persons with disabilities, both in terms of whether there is an objective to include persons with disabilities at the outset of projects, and in terms of whether the results of projects are actually inclusive of persons with disabilities in practice.
Great, Polly. Thank you so much for that. And thank you also to Christian and Leisa for sharing your distinct perspectives on the issue of disability in data and for joining us in this discussion this morning. I think we've learned a lot from your different experiences. Now, I'm conscious of time. You have roughly around 12 minutes left, and great that we have a lot of questions coming through. So I'm going to just select some of them and suggest that if we don't get to all of them, which we won't, we will try and find some way to send out the answers with the recording, because we do have the questions recorded. So Polly, Christian and Leisa, just to come, and Hannah, I think you're also still in the room there with us. Polly, if I can just come back to you, because you've just spoken about the DAC marker there. There is a question in chat which one of the colleagues has also answered, but just maybe to get a quick kind of insight from you around the implementation of the marker so far, the disability DAC marker, and to what extent, I suppose most importantly, accurately, the reporting on the codes associated with the marker. So without going too technical, and we can send out maybe a note after this, but maybe just to hear quickly from you on that would be great. And I'll come to the other questions then.
Thanks very much for a great question. I think in a nutshell, there's good news and there's bad news. The good news is that the marker has been taken up quite extensively. I don't have the exact number at my fingertips, but roughly about 20 out of the 30 members of the DAC are already using the marker. So that's really positive. I think the less good news is that, as you implied with your question, there is still a big question mark over the quality of what they're recording. And based on some of the sort of attempts I've made to triangulate the marker data with other sorts of data, I think the quality is very variable. But for me, the most important thing is that the marker is now getting used. And I think that as the marker is used more and as people increasingly use the data for scrutiny and advocacy work, I think the quality will follow automatically through that conversation and that process.
Thank you, Polly. Thanks for coming back. And yes, absolutely, it will take some time for that to come about. Okay, so there's a few questions in the chat which are very much related to the Washington Group questions. And I know our panelists have a vast amount of experience in different technical areas. So I might just put this open to whoever would like to answer this question. I'm going to just group two of them together. There's one from a colleague asking about how national governments can administer the Washington Group questions effectively. And then kind of linked with that is, you know, in some countries we see that the Washington Group questions can end up having a lower prevalence rate. So I don't know, in terms of our colleagues who would like to answer those questions or address them now, if there's anybody from the panelists that would like to address that. And then Hannah, there was a question directly to you then about your presentation that I'll come to quickly as well. So yeah, so maybe Hannah, do I see you've taken your microphone off, please? If you're happy to address some of those questions, please feel free to do so.
Well, the Washington Group short set is designed to be simple and easy to use. So in terms of how to use it, you should be encouraged to use it widely. So whether it's added on in a census or added on in other specific surveys or considered within things like project evaluation or monitoring. So there are all lots of different options in which you can use the Washington Group questions. Now, it is only 6 questions, and as has been pointed out, those 6 questions don't include a focus on mental health aspects. So it will underestimate the prevalence of disability, plus the cutoff is people with a lot of difficulties or more, and that can be a little bit subjective. So we do know that it's useful for comparing people with and without disabilities, so people who say they have a lot of difficulties with the Washington Group questions and people who say they don't, to see where the big gaps are. But we also know that there will be an underestimation in the prevalence of disability. So we just need to be a little bit cautious when we're interpreting what it really means. And if you really want to know prevalence, then you may want to move to more of the extended sets, which also include mental health questions, things about upper body. I hope that answers that question. I think the second question somebody put in the chat was about this estimate about children with disabilities in school. And what it meant was that of the children, among children in the survey in Nepal, 57% of children with disabilities were enrolled in school in Nepal compared to all of the children without disabilities. So it showed that almost half of the children with disabilities were not registered at school, let alone attending school, whereas all of the children without disabilities were registered.
Thanks, Hannah. Thank you for answering that. And thank you, Polly, also. I think in terms of just time, I might hand back over to Mr. Christian Lohr for some closing remarks. Christian, please turn on your camera there, and we'd love to hear from you and I will come back then in terms of final wrap up for the webinar. So over to you, Mr. Christian Lohr. Thank you.
First of all, I'd like to thank every participant and all panelists for the great engagement today. I'm sure we have a really a great morning because we will get a formidable overview about different points. And I'm quite sure this morning, this different contributions will bring us further today and for the future. We saw today how important it is to collect and exchange data. There are still actions that need to be taken to improve data collection. The data needs to be taken in a meaningful way and within a certain time frame in order to make proper help and assistance for disabled people, especially in crisis. We heard today that disability is in most countries of the world linked to problems like poverty, social insecurity, low level of acceptance or unemployment. But I also saw this morning that there are tools available and there are great people that are concerned about making the life of disabled better. I hope that the still existing great lacks and problems regarding data can be faced in the future. But don't let us forget, data is not only about medical diagnosis and numbers and figures, but there are humans behind this diagnosis, and we need to see them and their personal situations. Our main goal should be to engage in the life perspective of these people and to improve it. Ladies and gentlemen, I look forward to welcoming everyone to the World Data Forum in Bern from the 3rd to the 6th October to continue the discussion on data and to make sure no one is left behind, including through inclusive data collection and analysis. Thank you very much.
Thank you, Christian Bloor, for those reflections. And I think that really important point about making that humans are behind data and that we must make sure to leave no one behind. And we're absolutely really looking forward to following the World Data Forum as Switzerland hosts it later in the next couple of weeks. So first of all, or lastly, I would like to thank you all for joining this webinar today. We've had a very packed agenda, so and I'd like to thank all of our speakers for sharing their different perspectives. We will be posting the recording of today's webinar on CBM Switzerland website under the same link as the registration. I'd like to also thank our captioners and our interpreters for joining us today. And I'd like to thank all of you participants for attending and for giving us some good questions and for interaction. And I'd like to wish everybody a good day. Thank you, everybody. Take care.